When you hear about a diagnosis like ALS, it's so easy to just see it as the end. But what if that's not the right way to look at it? What if we reframe it? Think of it as the start of a fight. Not for a cure that, well, isn't here yet, but a fight for something just as important. Function, independence, quality of life. That's exactly what we're going to dig into today.
So, first things first, what are we really talking about here? What is ALS? Well, it's a relentless disease, and it goes after our motor neurons. You can basically think of those as the electrical wiring between your brain and your muscles. And as that wiring starts to break down, the signal just doesn't get through anymore. The brain can't tell the body what to do, and that leads to this gradual weakness and eventually paralysis.
Now, this quote from Dr. Leo McCluskey, it just completely flips the script. He says the palliation of ALS begins with breaking the news. Palliation is a big word, but all it really means is care that's focused on making you feel better, on improving your quality of life, not necessarily on finding a cure. So what he's saying is, this kind of supportive, compassionate care isn't something that kicks in at the end. No, it's a journey that starts the very second a doctor delivers that diagnosis. And let's be clear, the stakes on this journey are incredibly high, because that progressive weakness, it doesn't just stop at the arms and legs. Eventually, it reaches the muscles we all need to breathe. And that decline in breathing function, well, that's the single most critical challenge. And for most people with ALS, it's ultimately what leads to death. Okay, so faced with that reality, you might think the story ends there. But it doesn't. Modern medicine has mounted a counterattack. And this isn't about just sitting back and waiting. No, it's an active strategy, a really comprehensive plan to fight for every single piece of function you can hold on to for as long as you possibly can. And this is maybe the most important part. You have to redefine what winning means. Since there's no cure yet, the goal of rehab isn't some miracle reversal. It's about something else. It's about preserving autonomy, right? The ability to make your own choices, to participate in your own life. It's about squeezing every drop of quality out of every single day. And just look at the team it takes to do this. This isn't a one-person job. It's a whole crew, all working together. Think about it. You've got the physiotherapist helping you stay mobile, which connects directly to the speech therapist, who's working on the muscles for swallowing. And at the same time, the respiratory therapist is focused on your breathing. See how it's all connected? It's a full court press to support the entire person, not just ticking off a list of symptoms. But this brings up a really tough question, right? In a disease that's always progressing, where things are expected to get worse, how do we actually know if any of this is helping? Is it making a real measurable difference? To figure that out, we've got to look at the data.
So let's do that. Let's zoom in on one of the most critical battlegrounds in the fight against ALS, breathing. We're going to look at one very specific therapy and see what the science really says about whether it works.
Okay, so this therapy is called respiratory muscle training, or RMT for short. And honestly, the best way to think about it is literally like taking your lungs to the gym. It's a super targeted workout for the muscles you use to breathe, your diaphragm and all those others, using resistance to make them stronger when you breathe in and when you breathe out.
So how do you find out if it really works? Well, the researchers didn't just do another small study. They did something much more powerful, called a meta-analysis. Imagine you're a detective. Instead of just looking at one piece of evidence, you gather all the best evidence from every previous case, you lay it all out on the table, and you look for the pattern. That's what a meta-analysis does. It combines everything to give you one solid, reliable answer. And they were picky about it. They only looked at 5 high-quality studies. And these weren't just any studies. They were all randomized controlled trials, which is the absolute gold standard in medical research. That just means they had one group getting the treatment and another group that didn't, so you can really compare and be sure that any effect you see is because of the training and not just random chance. It makes the results super trustworthy. And when you add up all the people in those 5 trials, you get a total of 170 patients with ALS. So that's a pretty good number of people, giving us a really solid base of data to work with. All right, so the stage is set. They've gathered all this high-quality evidence. What did they find? What did the numbers actually say? Let's get into it. The results were, well, they were really interesting. On the one hand, a clear win. The training absolutely improved the strength of the breathing muscles, both for breathing in and breathing out. So that gym for the lungs idea, it was working. But here's the catch. That extra strength didn't seem to lead to a bigger overall lung capacity. And it also didn't change how patients rated their own quality of life, at least not in a way these studies were able to measure. But there's another finding here that is absolutely crucial, and we can't just gloss over it.
The training was safe. Totally safe. In a group of patients where you have to be so careful, not a single one of these studies reported any negative side effects. That's huge. It means you have a therapy that can potentially help without the risk of making things worse.
Okay, so let's pull the camera back now. We've got this very specific piece of scientific evidence. So what? What does it actually mean for the bigger picture of caring for someone with ALS? How does this little puzzle piece fit into that whole philosophy we talked about at the beginning?
Well, the main takeaway is pretty clear. This respiratory muscle training, it's not a magic bullet, it's not a cure. But the evidence is strong that it's a really valuable and safe tool to have in the toolbox. It's what doctors call an adjuvant therapy, which is just a fancy way of saying it's a helper. It doesn't fix the underlying problem, but it shores up a critical system, your breathing, that you absolutely need to survive.
And that brings us right back to where we started. In a fight against a disease like this, you learn that even small wins are huge. Every little bit of strength you can hold on to, every function you can maintain for just a little bit longer. That is a victory. Every single one contributes to that bigger, more important goal, helping someone live their life on their terms for as long as they can. Ultimately, this whole approach forces us to look past the numbers on a chart. It asks us to think about something deeper. When you're in a fight where you already know the final outcome, maybe winning isn't about changing that outcome at all. Maybe it's about changing the journey itself. And that leaves us with this final, powerful question. In a fight with no cure, what does it truly mean to win?